Genetic testing. Genetic testing is testing what your genes are saying. So, as practicing physicians, what we know about genetic testing when we are in medical school and training and in clinical practice is genetic testing is something which we do it for young kids who has some kind of a single gene abnormalities like cystic fibrosis, like any other metabolic conditions. But right now, with the advent of the gene sequencing and massive gene sequencing from across the globe, right now this science, the genomic science, the genetic testing is being adopted into all fields of medical practices. No specialty in medicine is excluded from genetic testing because what the scientific community in genomic science is belief is that all the medical conditions have the root cause in their genes. So the deciphering of this data will become key in managing the patients going forward. For example, there is an validated studies published globally in pharmacogenomics. So each and every medicine we prescribe, so there is a chance right now that we can do a gene sequencing or a genomic test, and then we can predict what will be the response of that particular patient if he takes the drug. What are the chances that there will be good efficiency, and what are the chances there will be less side effects, and what are the drug interactions. So instead of doing this as a trial and error, we can now do a test and then decide which patient responds to which medication. So, and not only that, in terms of managing the chronic conditions, like we know as a practicing clinicians that not every diabetics will respond the same way, not just respond, not behave the same way. Some people are obese, some people are lean, some people respond to first drug lines, and some people need more than 4 medications. It will be very difficult for us to control in these scenarios. So when you narrow it down at a gene level, there are multiple genes affecting these presentation, the phenotypic presentation of these conditions. So by doing gene sequencing, the idea is that we can manage our patients more appropriately and with less side effects, providing good quality of life.